Okay, good afternoon, everybody. Thank you so much for coming. I think we're going to start. I think we're about squashed in here enough. Thanks for braving the weather and coming out today for our discussion of the dynamics of sexual violence in the Eastern Democratic Republic of the Congo, perpetrators, community response, and policy implications. My name is Gib Clark. I'm the coordinator for the Wilson Center's Global Health Initiative, the sponsor of today's program. I'd like to also thank our Africa program for co-sponsoring and helping out with the event today. A little bit about the center for those of you who haven't been here before. For those of you who have, I apologize for the repetition. The Wilson Center was established in 1968 by an act of Congress as the living memorial to President Wilson, recognizing that he was our only president to have earned a PhD. For better or for worse, they decided to set up a living memorial, bringing together the world of ideas with the world of policy. The center here has about 20 programs and projects, and the Global Health Initiative was started a couple of years ago in recognition that almost all of those projects were doing health in one way or another. So the Global Health Initiative was formed to sort of serve as a clearinghouse, uniting all that health work, but also to focus on a few specific focus areas of our own. And those areas are maternal health, health financing schemes, and today's discussion focuses on our last area, which is post-conflict and post-disaster health. We're very lucky to have three real experts in this field today. We're going to start out with a joint presentation from Michael Van Rooyen and Jocelyn Kelly from Harvard Humanitarian Initiative. They're going to discuss their research into the characteristics of gender-based violence perpetrators and look at policy responses. They gave a very similar presentation to this yesterday at the UN Security Council, which I'm hopefully will talk about a bit as well in their remarks. And they're also putting together the Humanitarian Action Summit at the end of March, and there's some info on that outside, and that's going to include a lot of the issues discussed today. Then we'll hear from our discussant, Mary Ellsberg. She's going to share her thoughts on Michael and Jocelyn's presentation, as well as reflecting on some of her own research into gender-based violence. Mary, of course, is one of the leading voices on gender issues and gender-based violence in particular. These people all have long, distinguished bios, but I'm going to give you the highlights real quick. Michael Van Rooyen is the founder and co-director of the Harvard Humanitarian Initiative and chief of the Division of International Health and Humanitarian Programs at Brigham and Women's Hospital. He's an associate professor of medicine at Harvard Medical School and an associate professor of global health at the Harvard School of Public Health. He's worked as a physician, policy advisor, and relief expert with organizations including CARE, Save the Children, and Oxfam. Jocelyn Kelly is the gender-based violence research coordinator at the HHI. Before that, she served with SRA International as an emergency management specialist and liaison to FEMA. She is a recipient of the Gareth Green Award for Excellence in Public Health Practice, the New Investigator in Global Health Award from the Global Health Council, and the Corbin Gwaltney Fellowship in Magazine Journalism from Hopkins. And finally, Mary Ellsberg is Vice President of Health and Development at the ICRW. She manages their health and development portfolio, which includes three technical teams: HIV, AIDS, and development, gender violence and rights, and reproductive health and nutrition. She has more than 25 years of experience in international gender and development research and program work. And before ICRW, she was at PATH, where she was the senior advisor for gender, violence, and human rights, and also headed up the Nicaragua office. She's also the founder of the Inter-American Alliance for Gender-Based Violence Prevention and Health, which, if you add all that up, somehow gets you to Intercambios. So there's much more information, all three of these, in the bios outside, but I won't take any more of your time on that. One final note before we start, you'll see a camera in the back. We're webcasting this event. It's on streaming live now, and then within about a week or so, we'll have it up for good. Archived on our website, along with the presentations and some relevant documents and a meeting summary. So please feel free to access that and forward to whoever you like for folks who can't be here. So again, thank you all so much for coming, and look forward to an interesting discussion after the presentations. And we'll start with Michael and Jocelyn.
We're going to stand at the podium here so we can see everybody when we talk to you. First of all, thank you very much for your tremendous interest in the topic, and it's great to have such a broad range of folks in the audience to talk about. So, you know, there's people involved in project work and policy work, so to have a little bit of dialogue around issues related to data and the issue of sexual violence is really interesting for us as well. So we appreciate getting your feedback in this. So we'll start out once again. My name is Mike Van Rooyen, and this is Jocelyn Kelly, and I highly apologize for the bio that was out there. I clipped it from the website, so it's too long. So where's the clicker, by the way? Oh, let me get the clicker. Justin, I'm going to move this. Sorry, we're getting set up here. So the issue of the way that we at HHI got interested in the issue of gender-based violence is really a practical one. We originally sent teams of surgeons to work at Ponzi Hospital to be involved in some of the fistula surgery was there because it was so complex, and we had a relationship with Dennis Mukwege, who, as many of you know, is a tremendous advocate in this issue. And having, out of our relationship with Dennis and with Ponzi, we became interested in some of the data at Ponzi and around the region. So much of our work is based in South Kivu, does not cover the north, and when we talk about our data, there are some limitations to it because of most of our data is from the south. Part of the notion, and all of you are familiar with this, so we don't have to go in great detail as to the background information about gender-based violence in the Congo. You're all aware of it, and that's why you're here. One of the big issues that we found, and when we presented to the UN Security Council the day before yesterday on this topic, was that there is a great need for reasonable data when it comes to quantifying and characterizing the issue of gender-based violence in the Congo. It's a big issue to the UN Security Council, and we'll talk a little bit later about the sort of realization and implementation of Security Council Resolution 1820 that really calls for getting accurate and timely data related to rape and sexual violence in the Eastern DRC in other settings in order to task the Security Council into acting in gender-based violence as a security issue. So the problem is, what is timely and accurate data? And there's a significant debate as to what constitutes data, what's appropriate data, and what they need to act upon. And so we'll talk a little bit about that and our approach to that. So as you would guess, in a climate that has significant insecurity, difficulties in access, remote areas, and in a topic that is as sensitive and difficult to address as gender-based violence and sexual violence, getting data on sexual violence in the DRC is difficult. And not only getting data, but getting reasonable, accurate, and finely grained data is actually fairly difficult to obtain. And so we believe it requires actually more than the single method of doing population-based surveys. It requires multiple methods of investigation to understand the complexities and the dynamics of gender-based violence in the DRC. Counting cases is difficult even in and of itself, and so there are many estimates, and people in the common literature or in reports throw around the number of 100,000 cases in the last several years. Care estimates have reached 400 people a month, or sometimes 70 women a day, and there's been the number of 27,000 people and women victims in South Kivu in 2006 alone. So there are difficulties in finding what is correct and where these data come from. And also, when you get these numbers, they don't actually characterize the problem. Right? They don't give us the real information that we require to provide services and protective services, reproductive health services, as well as policy related to how to affect change in the area. So the data, even when we get them, are not particularly helpful all the time, and they don't actually give us the finely grained information that we really need. So we felt, and Jocelyn will talk more about her work as well, that we need both quantitative data, counting numbers, and qualitative data, and understanding the problems in greater depth.
Yes. So you're left with this extremely difficult question of how do you look at something that's so complicated and so hard to learn about, especially when you can't do the counting that's often seen as the most valid form of investigation in science. The way we went about tackling the problem was to take a lot of different research methods and use these to triangulate findings. So using surveys to get quantitative data, narratives and interviews to get qualitative data, and putting those together to find out what's happening in high-risk populations, like women who have children from rape, like community men who people often don't talk to, survivors in remote villages. And when we reached out to these populations, we made sure to ask about different interventions, and those would include medical, legal, psychosocial, and health interventions, because all of those are part of addressing a problem as complex as this.
So a little bit about our research agenda and our approach to this is, if you think through many of the reports that you've seen previously, some cite numbers and some cite instances or quotes or narratives of women that have been attacked and suffered sexual violence. There are many gaps in these reports, many gaps of the characterizations of sexual violence and their occurrences. So, for example, I mean, what would you want to know? You'd want to know where they happened, at what time of day, what were women doing when it happened, who did it, what are the characteristics of the perpetrators, why, were they militia, were they non-militia, is this moving into the community, for example. You want to know protective strategies or community-based strategies that people are, women and families are adapting to. And speaking of families, what's the effect on the family? What's the effect on the structure and the fabric of the community? They're all important features that you just don't get from asking a quick survey in the field. And so it's pretty important to try to find that out. It has both policy and programmatic implications. So our approach was to look at issues that we felt were gaps in the data and gaps in our understanding of the characteristics of the problem. So those are things like the impact on women and men and families, resilience programs. In other words, how are communities responding? How are women responding? Adaptive protection mechanisms. How are communities able to adapt and come up with community-based protection strategies? And then, do they think NGO interventions and UN interventions are working? What do they think of MONUC? What about children, and particularly the extremely high-risk cases of children born of rape, and what happens to them? And then militia behaviors, motives, and some of the most difficult things to get, or find out what the militia are thinking, and not just what we anecdotally have heard, and not just what the downstream evidence shows us, but actually what are they really thinking, and how to get to that problem, which is tricky, but intensely interesting, and I think could provide some interesting insight as well. So, Jocelyn?
So we've covered most of this already, but the great thing about mixed methods research is it can be kind of a tactical, quick intervention where you go into a place where you know things are happening and you talk to different populations, and you're able to get data that is a little bit more nimble than these huge population-based studies that take years and years and millions of dollars. And that helps us get a really timely analysis of the trends of the problem. So how's it changing over time? You can get a quick snapshot at one time, but then you can go back and do that research again in the same population and ask how have things changed over the past month or 2 months or 5 years. So just really quickly, I'll talk about the populations that we decided to look at. Obviously, the most important population are the survivors of the sexual violence in the DRC. But the truth is, this is such a pervasive, traumatic, prevalent problem. It's not just traumatizing women who experience the rape, but it's traumatizing entire communities and literally tearing the fabric of cohesion that binds families and towns together. So we also decided to talk to men in the community. We decided to talk to service providers. What's their experience like? What's it like trying to provide services to survivors of violence in a very resource-poor setting? We also made the choice to talk to militia members. What's going through their heads? This is an obvious part of the problem. What are they thinking? And just on the horizons of the research, too, are talking to women who live with militia, either as combatants or as wives of the soldiers. And that A New Frontier also is miners and mining communities, which is a huge industry in the DRC, and as we mentioned before, children born of rape.
So a little bit about our findings. We're talking only about findings of a couple of the studies. We have a number of studies going on. Two of the studies are a hospital-based study looking at retrospective data from Panzi Hospital in this case, and then we're also looking at Heal Africa in Goma, so we can get data from North Kivu as well. But the findings we have here, the preliminary findings, are from the south. And so they have some caveats to these data. They are not random samples of the population. We don't go through the population and find out, the percentage of women in the entire population, for example, that have suffered sexual violence. These are women that self-present to Panzi Hospital, and therefore they're probably not representative of all of the cases of sexual violence. They're probably going to be the most severe cases because these are women that have physical manifestations, pelvic trauma. So it'll probably select for women that have suffered gang rape, for example, or instrumentation or other violent forms of assault. So these findings need to be taken. I think that they're useful sort of marker of what's going on, but they cannot be extrapolated to the rest of the community. So a couple of our researchers that did this, Susan Bartels and Jen Scott, both physicians, both worked at Panzi as well, and started the abstraction of the medical data. The first things we want to know is, what are the ages of women and the age range. The, of course, horrifying age range of 3.5 to 80 years old realizes that nobody is immune to this. Interestingly, the average time to presentation, so when a woman presented after sexual assault, was incredibly long. So if you're looking at reproductive health services, for example, or HIV prophylaxis within 72 hours, it just ain't happening. And it's not happening for a lot of very basic logistical reasons. And I'm not presenting all of the data here, but we've talked about, or we investigated some of those reasons as well. The remoteness of where women are presenting to, the difficulties in transporting themselves and their family to find access to medical care, a lot of reasons why women can't and are not accessing timely medical services. Timing is important. This slide is very simple, but timing is very important in terms of when it happens, because we get to start to characterize, when people are vulnerable and what times of day people are vulnerable. So women, particularly at night and in the evening time, are vulnerable. And contrary to our understanding of the patterns of violence in, say, Darfur or Chad, where women are most vulnerable when they're collecting wood or they're out. So they're walking or transporting water or food or whatever. This happened to be the case that most of the occurrences happened in the homes of women, and so 56%, and indicating that this is actually a problematic trend, as you might guess, because women are not safe in their own homes, they're not safe with their own families, and so they're being assaulted not only in front of their husbands and children and in their own homes, but there's no sense of safety. So it really has some major protection issues and implications for protection, and also maybe future implications for the tasking of MONUC and military forces and police as well. So it has some significant implications. The types of assault also are emblematic. Now, again, these are women with oftentimes with severe pelvic trauma, or that requiring medical services, and so they probably select for a greater sort of trauma anyway. And so gang rape was defined as 2 or more perpetrators or 2 or more assailants was the norm in this case. And sexual slavery, women being abducted, for example, and taken into the bush, for example. These, both gang rape and women abducted and taken into the bush, cause obviously and by the data, a high degree of vulnerability for these women, both vulnerability because they could become pregnant, also vulnerability because they develop manifestations, physical manifestations and physical injuries, as well as just being gone and their dissociation from their family. And I won't go through this, but it just indicated that women who were abducted as sexual slaves, women who had multiple assailants, were just more vulnerable. They were more vulnerable to the prospect of infectious diseases, more vulnerable to being shut out of their communities. And Jocelyn will further elaborate about the community responses. But so the hospital-based studies, what they do is give us some insight to things that we probably already knew, and some more surprising insights as to the types of things that are happening. This is the 2006 data that we've looked at as the first step of getting the probably 10,000 medical records and getting a more complete picture of the South, and then we're also analyzing the North as well. Jocelyn?
So I'll just speak a little bit about the Community Attitudes Project, which draws in this survey methodology. So a lot of the percentages you see come from surveys that were done both at Pansy Hospital and at 2 very rural field sites, and there were about 385 surveys administered by a team of local nurses. We also conducted 14 focus groups between myself and my colleague Sadia Haider, and that was involving 167 women. And in addition to that, we did 5 focus groups with community men. So just to go over the findings very briefly, to reinforce the difficulty women have accessing services, 45% of women said it took them over a year to get to services, and this was our cutoff point, but women often took, as you saw before, up to 10 years to decide or to be able to get to a hospital. 46% of women reported it took them more than 1 day to reach services. Again, this was our cutoff, so a lot of women had to travel for 5 days, 10 days to get somewhere where they could receive care. And only 8% of women received care within that 72-hour window that is so crucial medically to give HIV prophylaxis. We asked women about their experiences with services and what they found useful and what they found most important, because in the end, women are really the ones who are the recipients of this. So 40% of women, not surprisingly, said that medical services were the most useful intervention that they could receive. But kind of surprisingly, really close behind that, 28% of women reported that income-generating training was the most useful intervention, even above medical or psychological care. And I'd like to ask you to keep that in mind as we move forward through the slides.
There you go.
So just touching on this issue of stigma and rejection that we're all probably very familiar with, 32% of the women that we talked to in the survey said that they had experienced rejection by their families after being attacked. And this is not metaphorical rejection. Women are literally kicked out of their own homes and forced to forage for themselves on the streets or in the forest, often with many children to take care of as well. 15% of women said that they were kicked out of their communities as a result of being survivors of rape. So again, this is a pretty shocking number, and the vulnerability of this already vulnerable population is startling, because women that have no community and no family really have nothing. And another interesting finding in the survey of service providers that we did, we found that many healthcare workers were not aware that this kind of rejection happens. So 40% of providers said that rejection by family never happens, and 50% said that rejection by community never happens. And this really speaks to how can you design services for a problem that you actually don't know exists. So we're going to just move really quickly into the qualitative data now and talk about the focus group findings. And the way that you analyze this data is you find a robust theme when it comes up again and again, spontaneously, in different focus groups in different regions by different populations. So the findings that I present here are those really strong findings that come out. Both women and men said that rape of women in Congo has not diminished with the end of the war. And there's actually a consensus that rape is either staying at wartime levels or is getting worse. And just to remind you, it's not only traumatic to the victim, but extremely traumatic to the family and the community as a whole. Survivors of rape face this deeply entrenched stigma in their own communities and their own families, and they're really seen as no longer useful members of society. So if you think back to that figure where 30% of women said that income-generating training was the most important intervention they could receive, it speaks to the fact that income-generating training gives them a vehicle to find a role in society again, where they can earn money for themselves and earn money for their children. And once they're able to do that, then often they're welcomed back, either by their husbands or welcomed back into their community. We also asked men and women what they perceive the obstacles to reintegration being. Once a survivor of violence is abducted or leaves her community to seek care, she often has extreme difficulty going back. So women said that the largest obstacle was obviously this rejection by her husband, and husbands are known to kick a woman out and then remarry a woman who's seen as untainted. But close behind that were negative community attitudes about HIV and STIs. So there's a wide awareness that AIDS is a killer and that it is transmissible, and this kind of translates into this fear that survivors of violence are vehicles of AIDS. Women also experience traumatic fistula, which means that they have urine running down their legs. They obviously smell bad since they're not able to control their bodily functions. And as you can imagine, this makes it almost impossible to lead a normal life. Women that have children born of rape, often if women are abducted, they become pregnant and then they're released from their abduction to go have the baby in the forest or wherever. These children are really hard to integrate into the community. It's difficult for them to find school services, and the mothers are also highly stigmatized. Women are really afraid of being raped again. There's a lot of repeat rape in the DRC, so they often don't want to go back to the place where they feel extremely vulnerable. And again, this question of financial support and income generating training is arising again. It's seen as extremely useful. Another finding from the focus groups was that the practice of rape has jumped to civilians in almost an infectious manner. Both men and women said that Congolese men are now committing rape against women in their own communities, whereas before this was not seen as a problem. And I'll let you read the quotes for yourselves, because they say it much more eloquently than I could. So the next step, of course, is to ask women and men what they think about interventions and what they see as possible solutions to this seemingly intractable situation. There's an overwhelming cry for punishment and an end to impunity for perpetrators. There's hardly any justice or legal system to persecute crimes, and certainly sexual crimes are the hardest of all. Everyone wanted an end to insecurity. Obviously, you can't fix a problem when there's still a war going on. And then economic solutions to help women, but also men. Men were really eager to find jobs and to be able to earn a living wage. Men, interestingly enough, were the most enthusiastic about sensitizations and training. They seemed very eager to learn more about the problem and how to identify and treat sexual violence and how to respond to it. And then women were extremely excited about getting education for themselves and for their children. This is a highly uneducated population because women are not given the opportunity, usually even to complete primary school.
One of the big issues then this brings up is any upstream strategies that can be employed to address the situation. Now, there's difficulties, of course, in prosecution, and none of us in the room would want to undermine possibilities of prosecution and bringing people to justice. However, there are some root features in all of this that need to be understood, and that is the composition, the motivation of perpetrators, what are they thinking, where this comes from, and some concrete strategies that can be employed within the command structure of militias that can maybe stop this, because that's while justice is essential, while bringing people to justice is essential, it's also to stop the perpetuation of this epidemic is a big feature as well. So we've had a lot of early discussions, and Jocelyn just completed a pilot project, which she'll describe, in looking at motivation of perpetrators and or motivation of militias, or getting access to militias and understanding militias. And this is all just a pilot study because we were testing the tool and trying to test the methodology and tweak it, with the hopes of then getting the funding, the resourcing going back and getting access to the militias. And we think that we have some pretty good access to the militias to find out about some of these issues. You want to comment briefly on that?
Sure. So through a remarkable NGO named COMPS, I think we were able to find unprecedented access to my militia members and have them speak a little bit about their own experience with the violence and their own day-to-day lives. So just very preliminary results coming out of that show us a few themes: that rape is strictly forbidden by the Mai belief system, but widespread reports by women indicate that this is obviously not prohibitive against committing these acts. This is not a ragtag militia. The Mai are extremely well organized with an excellent information infrastructure, and they're able to communicate messages very effectively throughout the command. Women are living with the Mai either as wives of the soldiers or as actual combatants, and they often take roles of information gathering or intelligence. And the soldiers' main source of information about sexual violence comes from the radio. So almost all of the soldiers we talked to had been exposed to educational messages that they'd heard on the radio about sexual violence, and there was a wide acknowledgement by soldiers that rape carried the risk of disease transmission.
So we'll just wrap up by talking about a few policy implications that may affect the way NGOs consider programming and the way the UN and donor countries may kind of contemplate the future of addressing this issue as well. Again, these data are limited, and they're to be they need to be contextualized in terms of their limitations. However, they do tell us that they ask a lot of new questions about characterizing gender-based violence in the Congo and how to do that, and what major issues need to be investigated in the future. Some of the policy implications that we've talked about is that service providers, at least in this study, in many cases were not well trained and did not necessarily have the awareness of the implications, particularly the social implications that women face, and that needs to be remedied. Now, there are many excellent, reputable, well-trained NGO people out in the field, but there are also many community-based organizations that may not have the training to address this, the complexity of these issues and what women face. As Jocelyn pointed out from her discussion, and this makes a lot of sense, that women and survivors of violence are viewed with intense negativity by their own community, and the act of sexual violence disrupts the family structure in the community. And it's not like the United States or in European countries where you have a social network where you can go and go to the social worker or present to the emergency department or get protective services, or the family is the root of your ability to stay alive, and that issue is a huge problem for women. A rape occurs in homes. This issue of occurring in homes needs to be better explored. While the data is relatively preliminary, it's also worrisome that protective mechanisms of looking at protecting women as they travel, for example, or collect wood or water or travel with their families will not be sufficient. And additional protective strategies need to be considered and employed, such as retasking MANUC, for example, if that's the case, or community watch systems. And in the Security Council resolution, this notion of a rapid reaction force, or the ability of organizations to military organizations to react more rapidly. The notion that sexual violence is pervasive and creating, to some degree, a culture of rape within Congolese society. This was not a feature of Congolese society previously. This was rape, and sexual violence was not endemic, and is most of the people that we've discussed with this, it is not. There are issues like with every society, but it was not to the degree that it is now, and so there is a significant worry that this essentially this leap into the civilian structures, such as police and people with authority, really causes a lot of concern and needs to be addressed, both in educational campaigns as well as the enhancement, actually the rebuilding of the judicial system. And then finally, this notion of data, and we won't comment on the implementation and all the issues related to 1820, but there are data implications to 1820 that create an interesting debate, and we had that debate a couple days ago talking to the Security Council, and that is the use of data by the Security Council to make a decision. Typically, the Security Council wants UN data, and they want information that they can attest is reliable and accurate. They don't typically use a composite of NGO information necessarily, and so we don't want to, at least I think we don't want to, state that you have to have population-based data that is that is representative of the population. It's great data to have, but if you wait for that to take action, it'll be very difficult to take action, because it's very difficult to get these data, particularly in sexual violence, particularly in the DRC, and particularly in regions that are insecure. So, there may be a place for convening some sort of advisory panel to the UN Security Council, for example, that looks at existing data and says what seems to be real, what's not real, and gives at least some advice as to the validity of these data and what could be useful and potentially acted upon. And so, like any research project, it brings up future needs and future topics and questions that we have looked at and felt were of interest as well. We need to know more about the North and get access to the North and better characterize what's happening in the North, because having access to the South is fine, but the North is indeed a different world. understanding this notion of perpetrators and militias and command structures and how this can give us opportunities for intervention, I think would be very useful and a very worthwhile venture to try to get additional data. Understand specific vulnerable groups like female combatants. We didn't list it here, but other vulnerable groups, for example, men who have been assaulted, and so male victims of sexual violence. In Uganda, northern Uganda, possibly 9.5%. In Liberia, numbers have looked at almost 19%. I mean, these are real numbers and need to be addressed. And talk about stigma, they're very difficult to get to. Characterizing the role of minors in mining communities and what happens. We know, and you know as well, the proximity of militias to mines and sexual violence all coexist, and it's important to know the dynamic there. Addressing vulnerabilities of children born in rape, we discussed. Recovery, the effectiveness of NGO and UN interventions, and finally, how do we get a hold of all of these disparate data sources and come up with some composite picture that is to some degree reliable. So with that, I think we'll turn it over before questions. We'll turn it over, and then afterwards we'd certainly welcome your questions and comments and thoughts and debate and all of it. So thank you very much.
I brought mine and now I've lost it. Thank you very much. I have to confess, as I start out, that I found this invitation exciting but very intimidating, given that I'm not an expert. I'm an expert neither on sexual violence in conflict nor in DRC, which may lead some of you to wonder how I ended up on this panel. It was exactly what I was thinking myself yesterday as I was preparing this presentation. However, I think that perhaps there's some useful contributions I can make looking at the same issues from a different perspective. And often the work in humanitarian field and conflict, a lot of the same issues are being addressed that we are going through in terms of data interventions on the side of looking at violence against women globally. So I think I find that many of the conclusions and issues that I will bring up here are very much in sync with what you've been discussing. So I will try not to repeat and go and then talk about a little bit about really emphasizing what I've learned from the presentation of Michael and Jocelyn, which I think was a fantastic study, and some of my reflections on that. Okay. This way?
Forward one. Yeah.
Okay. So a few points that came to me that struck me as I was reading the study. One, that women are not only victims of sexual violence, and the corollary to that is that women are not the only victims of sexual violence in DRC. What do I mean by that? First of all, sexual violence in conflict is only one of a myriad forms of violence that women have been suffering all their lives. Child sexual abuse, early marriage, domestic violence, and in most countries, forced rape or forced sex in marriage is the most common form of sexual assault. Clearly that's been overtaken in DRC. But women are not, it is not that women had peaceful lives living with, with equality in their families and communities before the conflict started. And so I think we have to remember that you can't really divide one kind of violence against women from everything else that they're experiencing, and you have to see it together. The other piece, which I think Michael and Jocelyn made the point very well, women are not the only victims of sexual violence. Not only are there many documented cases of men and boys who have been victims of sexual violence, but the whole purpose or main reason now that sexually violent violence has become so rampant, prevalent, is that the purpose is actually to destroy the social networks of communities. and have the devastating effect that it has been having, is one of the reasons that it's now being considered a crime against humanity. Another issue, and we did not agree upon this beforehand, the issue of methodological challenges and the importance of mixed methods. I won't go into the methodological part because I think you've covered that really well. It's a challenge that we're facing in documenting all forms of violence against women. But for example, violence in conflict together with trafficking and femicide and a few other issues that really haven't been well documented were highlighted in the UN Secretary General's report on violence against women as areas that need a lot more documentation. And clearly they need different methods than methods that we've developed to study sexual violence in non-conflict communities or domestic violence, for example. And I was just thinking about a meeting that I attended a few years ago organized by UN and UNFPA, UNDP, and WHO, where they were trying to integrate sexual violence into existing information systems for conflict settings. And there were a lot of experts who dealt with different kinds of information systems. And the question was, can we use these methods to document sexual violence? Can we integrate sexual violence information and data collection into these systems? And after 3 days, we pretty much all concluded that the answer was no. The systems weren't based on, for example, usually multi-methods, but for example, there was a very broad data set on human rights violations, which was based mostly on community reporters, sort of human rights defenders, and newspaper articles, because a lot of the human rights abuses were actually being documented in the newspapers. When they sat down to do sexual violence, knowing that it was a big problem in Guatemala and in other places, there was zero. It wasn't reported. It wasn't reported at the communities. We all know how stigmatized it is. People don't report it. And so that system doesn't work. There were a few other ones, service-based, for example. Injuries from gunshot are much more likely to be reported at a hospital or health system than sexual violence. So again, even if you could get them to have a system where they're collecting the information, the likelihood of having meaningful numbers is very low. So I really applaud the efforts that you've made. I totally agree with mixed methods. Same with population-based surveys, which I've been working with a lot to document domestic violence in a population that's moving, that's in chaos, that's in danger. It's very difficult to do again. That brings me to a point that has to do with the ethical side of doing research on sexual violence in conflict areas, which is similar to the ethical problems that we deal with all sorts of research on violence against women, but I think it's really aggravated, exacerbated in this case, which is that we can be putting women at risk, both of trauma, secondary victimization, but also at physical risk of their lives by asking them about experience of sexual violence. Particularly in this case, it came out in Darfur, where a lot of the authorities were the ones who were perpetrating the crimes. And so it could be very dangerous for people to denounce any kind of crimes that were being committed by local authorities, for example. WHO has worked a lot on ethical guidelines for doing research in different kinds of settings, and one of them has been on specifically on doing research on sexual violence in humanitarian conflict settings. And one of the big issues, the main purpose of the ethical guidelines is to make sure that we are minimizing risk both to respondents and to interviewers at all times, and that's emotional risk, physical risk. And one of the questions that they ask, and I will just throw it out here because I think it's an important one to keep in mind, is basically anytime you do research in this area, you have to have a pretty good reason for doing it. And you have to have some indication that the people you're interviewing are going to get some actual benefit out of it. We're not going to collect information systems just because it would be nice to have the numbers and the Security Council would like the numbers. We can't put women at risk for that. So we have to be always, I think that's the standard that we need to be using on ourselves to continue research. So few issues that I thought were issues always when we talk about violence against women. They're endemic, but I was just struck by how much worse they were in DRC. One was the issue of complete impunity. Prosecution of perpetrators is difficult anywhere, but here, obviously, it was completely non-existent, and the justice system is totally not working. And the the Special Rapporteur on Violence Against Women of the UN, who just recently did a report last year, lists dozens and dozens of examples where officials, military officials, have been accused of horrific sexual violence and atrocities, and then are just moved around or promoted or just still staying there with complete impunity. The other issue that my colleagues brought up was the issue that women are not receiving any kind of timely care. And the few women that we know about from the services are obviously just the tip of the iceberg, just a very small amount of women who need support. And then the issue of stigma that you also covered, I thought, really well, and I was really impressed by it. But then I wanted to make a small reflection here, which is that on the issue of stigma, most victims of human rights abuses or crimes are not seen as, they're not seen to be blamed. They're not blamed for their crimes. And that's different than from women who have been raped or women who are victims of sexual violence or domestic violence, where we usually assume that whoever's been raped or victimized did something to provoke it, wore the wrong clothes, went to the wrong place, or deserves it somehow. And that sort of pervasive air of stigma that attaches not to the perpetrators, and in this case it totally doesn't attach to the perpetrators because actually now perpetration is becoming seen as a much more normal activity. So I think when we talk about how to integrate women, I think we have to think very clearly about stigma reduction activities and strategies, and there is some work, particularly in HIV now, that addresses stigma, and I think we could learn from some of that. I wanted to go on to the piece about, you're going to tell me, right? No, I have your watch now. Sorry. Okay, it's not too bad. The issue about rape as normal behavior, again, was one that I found, particularly shocking, very scary, and the finding that increasingly you have civilians perpetrating atrocities and sexual violence. This is particularly upsetting or disturbing because it means that during peacetime, there's no indication, there's no reason to think that sexual violence is going to go down. It is so much a part of the culture and of masculine identities right now. And an example I was thinking of, if any of you are familiar with Cambodia, another post-conflict society, where it's come out in the last 5 or 10 years that gang rape is very prevalent in a way that it didn't used to be 30 years ago, and that that college students, college boys, and consider it sort of a male bonding activity now, and commonly will gang rape either sex workers or their schoolmates. And this is seen as really not a bad thing. It's just something you do to hang out with your guys, with your crew, to have a good time. So I can imagine something like that is sort of reminiscent of that, which means that we're going to really have to look specifically at the issue of masculinities and violence and do a lot of work with men and boys to really unlearn these kinds of norms, which is a huge thing. So in terms of the key issues, from what I've said and what I saw in the report and the Special Rapporteur's reports and other reports of activists that I have read, I think the issues that I saw as the key ones are very much what you had put in there. The first one is ending impunity, and that's not just at the justice system, strengthening special reporting measures and police stations and strengthening the justice system at the local level. It's also ending impunity overall with Army, with non-state armed forces, and with peacekeeping forces who have been also implicated in atrocities and sexual violence. The United Nations has declared zero tolerance against sexual violence, and Resolution 1820, 1820, also refers to this, but it's not really being seen on the ground. The other issue was more timely support services, making them more accessible, integrated, not into just sexual violence. That's one thing we've learned, but they need to be integrated into all kinds of reproductive health services and HIV, and mentioning that women need also access not just to post-exposure prophylaxis, but also emergency contraception. And then the prevention. And the three issues that I was thinking of were specifically around the stigma reduction, changing gender norms, and making sure that we understand again that all members of the community need to be involved in this effort, that it's not just for perpetrators and it's not just about victims. I wanted to say a word about the issue of motives. It was a little bit in your report, but you didn't discuss it too much here. The motives that perpetrators have for a specific rape. Is it opportunistic? Is it gang rape? Is it sexual enslavement? And I just want to throw out that I find that a little bit problematic, because I think that I think the motive for rape is probably pretty similar, no matter who you talk to. The way you do it is opportunistic. It has to do with the opportunities, the impunity, the context. So I'm not sure. I would be surprised. Somehow talking about motives to me says that there's some kind of rationale around it rather than simply they have the opportunity to rape and so they do it in different ways. But I think that's for future dialogue. The issue of additional research, I completely concur with my colleagues' proposal to look at both mixed methods, combine lots of different sources and lots of different groups that you're researching, triangulation. I think it was fantastic. The idea of producing information that's timely, that perhaps could be used for early warnings, and that decisions can be made on. But we also need other kinds of information. We need information, research about what works and what doesn't in terms of our policies and our programs. Some of that can be done quickly, and some of it, impact research, is more difficult. And I'm sure you're aware that IRC and the London School of Hygiene and Tropical Medicine are right now doing a very ambitious impact study on IRC's work in several different countries. So I think those kinds of methods and that research will really have a lot to share. Also, I wanted to highlight Measure Evaluation's compendium on indicators for violence against women, which has a section on indicators that can be used to monitor the success of programs working with women in conflict situations. It has to do with having protocols, having trained providers, having information systems, and so forth. So I think that's also a very useful contribution. And my last point is to remember, we've been talking about women a lot as victims of violence, and women are not, and Congolese women are much more than victims of violence, although, that's how we're mostly seeing them right now. They're survivors. They have resilience. They are peacemakers. They're activists for women's human rights. And I think it's just it's a word of caution that if we pigeonhole them into this box of of victims, we're actually disempowering women. And I think it's really important that we be thinking of women as front and center, not just as the victims, but also as the decision makers. The Congolese Women's Campaign Against Sexual Violence, for example, one of their big demands is that women's organizations and activists should be included at all levels of peacemaking, at all levels of planning interventions around the crisis, that they should have much more leadership and should be supported in that. And I really support that. And I think I'm done. But thank you very much. And
okay, thank you very much for those three great presentations. As I said before, we're webcasting, so wait for a microphone to come around if you have a question, and let us know who you are. Who wants to get us started? Over here, Will.
Hi, I'm Kirsten Stewart with the Family Violence Prevention Fund. I wanted to extend my thanks to the presenters as well. Mary, obviously, I particularly appreciated your comments that the violence often begins before conflict and will continue after, and that in our policy responses we need to understand that continuum. I also wanted just a very specific question about the research. Did you look at any of the, I was thinking of the positive deviants, the men who aren't violent, and what distinguished them from the men who were, and particularly around their own experiences of childhood sexual abuse, which would kind of be my guess is one of the distinctions, but is obviously incredibly hard to ask about. But I didn't know if there were others that you had identified.
I'll just lead in by saying that, you know, so far the community groups of men, and Jocelyn will talk about that, actually focused on community responses and attitudes towards the phenomenon, not in addressing or interviewing perpetrators thus far. So we have not had any serious attempt to be able to engage community-based nor militia perpetrators so far. So we haven't been able to characterize that. Justin, you want to comment on that?
Yeah, it's a phenomenal question, and I think finding men who are willing to act as role models and advocates is probably at the core of an intervention with community men. Men are surprisingly eager and excited to talk about the problems that they face, and we have had a lot of conversations about violence against men and motivations for perpetration. It's a question we ask all the time. What do you think drives men to act a certain way, or what do you think drives men to not act a certain way? And again, the results with militia are extremely preliminary, and I think we'll be able to go back and keep asking those questions. With community men, I think it's an area for further research, but there's such a outcry to do a better job of protecting women and learning about sexual violence. It's really just exciting almost to be around those groups.
One of the implications from the degree of enthusiasm from the men's groups, or the responses from the men's groups, indicates that programs that also bring men into the solution, and men's groups in the prevention of sexual violence, for example, are also pretty important, viable strategies, and their engagement is really important in this.
In the back right there, Will.
No, okay. Hi, my name is Sarah Friedman. Thank you so much for a really provocative presentation. First, Mary, I was relieved to hear your statement at the end, in particular about women as survivors and not only victims, the resilience, not only caregivers, but peacemakers, and the strength of women. And that's something that I've been sort of struggling with for a lot of years. I wanted to ask, though, if you addressed boys and girls under 18 in any way, if you looked at them, and if so, did you find any differences at all?
I think for IRB purposes, and because we're extremely sensitive to issues of re-traumatization and stigma, we don't reach out to those hyper-vulnerable populations. And I do want to just make a quick note about the research that we only seek out women who have already come forward to tell their story and are already at points of service. So we do not go knock on doors in villages where women can't get services and re-traumatize them by asking about something. So again, you really have to balance exactly what Mary was talking about, ethical considerations and re-traumatization concerns, with the need for more information.
Up here, I think there's two right in the middle here.
Thank you. I'm Chuck Pill with Futures Group, and I work in DRC on policy issues and orphans and vulnerable children issues. I was curious if I could kind of jump into the policy part of your research, and I'm wondering, has the law that was passed, and I think it was in 2007, against rape, which there are different donors, I think, funding activities in the Kivus around implementation of that law. Have you seen any impact of those activities or the legislation, or does that come up in your conversations around your research and links with government agencies at all?
And I think those of you who've been there and are actively working, particularly implementing agencies, would probably know this better than we do. I think that, our conversations with Manuk and their interest in buttressing those efforts as well has, they're fighting against a system that is horribly broken, and so it's. I think the consensus is this is going to take a long, long time to actually see a change. But I mean, you might comment in your experience.
Well, I was wondering because of the richness of the data that you all presented, and maybe through the more qualitative side of your research, which is conversations and focused discussions, if any of that had crossed your radars, just as if there's some, example of it in practice.
We definitely asked women a lot of questions about justice, their access to justice, and their willingness to seek help in the legal system. So we found that more women, the vast majority of women, were very excited at the thought of seeing their perpetrators arrested. But I will say, when we asked the question, would you like to see the perpetrator of your crime arrested, they took a moment and thought, and then just laughed. And that was the response to that question.
There's lots of fear and implication.
And then they said yes. It really took them a second to even think about what that would look like. And then there was a processing of the actual words. And then we also asked the question whether they would personally be willing to come forward and perpetrate that crime. And not surprisingly, those numbers were lower, just above 50%, I think.
Can I add to this just that, not being an expert, but I did read the Special Rapporteur's report on DRC, and that was a huge issue. That not only had the government had not assigned any resources to implement the law, that and so implementation and funding, resourcing the law is one of her major recommendations, and also that basically government officials were not only unable because of sort of the disarray of the justice system, but unwilling really to implement the law.
When I was in Kinshasa last month, there was marches in the street led by the federal level minister and the provincial minister. This is in Kinshasa, against violence against women, which was all funded by, I think, UNFPA or UNDP. But I don't get the sense that it's really echoing to where the epicenter of the epidemic is. Thanks.
If you could just pass it across there.
Thank you for a very interesting talk. I want to talk to a point of Mary's that you also made about what's going to happen in the future and the rapes that are now happening in communities among, I assume, the same ethnic group, although you haven't mentioned ethnicity. And I'm sorry I was very rude when you were talking, but in fact, this is probably a cultural model. And what I recommend is that you look in Cultural Anthropology, May 2008. I don't know if you've read that. It's an article that looks at the history of exactly this kind of sexual torture and rape and gender-based violence in this part of Congo. And it was started by King Ludwig's regime, and that's why they call it red rubber. So I think there may be some models that are going on here, and you might want to look at that.
Next, if you could just pass the microphone up to two people here. Thanks.
Hi, my name's David Aronson. I'm a freelance writer. The conventional explanation, as I understood it, for rape in the DRC was that there are all of these local level internecine conflicts going on, and that as a result, and that rape has been an act of war, an attempt by one community or another to control or gain access to land or minerals, et cetera, et cetera. In other words, it hasn't been merely opportunistic, but has been, in fact, targeted and deliberate and so on. And so I'm wondering, did your work reveal any patterns in that regard? Or has rape now sort of metastasized and become just sort of this general crime that everyone is, in fact, opportunistically committing? And if so, what has happened to the men in that community that they are so willing to engage in this kind of behavior?
Well, just the the occurrences that the cases you read. So you get we get a narrative from Ponzi Hospital, for example, and it talks about the occurrences and what happened. And it's difficult to conceive that there is a singular motive. In other words, there's a singular motive, whether it's community destabilization, essentially personal family terrorism, whether it's a military tactic. We've not been able to get to the militias yet to find out really what they intend and really what they want and really why they did it. So you have to look at the after effects and the evidence of what happens to women. But I believe that the logic behind raping a woman with sticks and then shooting her in the pelvis with a machine gun is different, is likely to be different than a forced marriage, which may be different than breaking into somebody's household for a single episode of rape, which may be different than the bonding experiences between militias, that young militias as a rite of passage have to rape a woman repeatedly. So while we have not been able to establish the motives with militias, the detail, and we get great detail as to what happens to women and the types of injuries that they have, seem to indicate that the motives are varied and the militia groups are varied, so that the Rasta, for example, a very small group that can have perpetrated horrific crimes that you can scarcely believe, and maybe as a tactic of true community destabilization or control of a community, but doesn't necessarily translate to all militias, and certainly not to community men who may then adopt that methodology as getting back at a thwarted lover, or at getting back at a family grudge, or as some sort of juvenile bonding thing, or whatever it is. So we have got very little data on community-based motives because we don't have a lot of information about that, and our based on what we see, we're only speculating as to the military motives. However, they seem varied. Do you want to?
I just want to make a quick note, too, that I think it's really easy to demonize community men and think that they're all potential perpetrators and how could they possibly do this. But some of the most lively and engaged and incredible debate that I've had is certainly with the community men, and this just kind of outpouring of rage at what has happened to them and their communities and their families. And I think you have to remember that the men, so many of the men have worked tirelessly to fix this problem, and they're such an asset. And I think that it's important to remember that this is another huge asset in a group that needs to be worked with to treat the
Can I jump in there just because I brought it up at the beginning. I totally understand what you're saying, that the contexts are different, the sort of the logic of why certain groups of men would perpetrate different kinds of acts may differ a lot. Do you expect perpetrators to actually to have the insight to be able to say why they did it in a way that we would find meaningful? A lot of the studies here that try and look for causes of violence by looking at individual perpetrators or risk factors just haven't been very fruitful. And men can have lots of reasons of why they murdered their wives or why they beat them, but to say that that's actually the motive somehow to me gives sort of too much credence to their interpretation. It may be the reasons they give, or the way they justify it, or there may be circumstances that are triggers. Like in domestic violence, we don't talk about causes or motives. We talk about triggers. There was alcohol involved. There was sexual jealousy involved. So I'm just kind of thinking about the words.
I completely agree. I think that over intellectualizing or trying to overanalyze the motive in this case may not be fruitful or worth it, or even accurate at all. And I think that we place a lot of our presumptions in this as well. So I think that, but at the same time, I think that the way that this affects the community speaks to some varied motive. Now, whether they think,
Very
yeah, I'm
patterns.
destabilizing, yeah, well, exactly, fair enough. But, you know, am I destabilizing the community? Am I using rape as a weapon of war to control a community? You know, maybe they're not thinking that, but there is certainly differences in behavior and differences in the way this comes forward, and I think differences in the way soldiers are recruited into it, for example, that's and the injuries that women have that speak to differences in the genesis of it.
And just a note again about the methodology, we're not the ICC. We don't care about finding out who did what, and we never ask someone, what did you do and why did you do this? We ask them about their experiences in the past and their communities and their day-to-day life and what they've seen happen. So men talk a lot in anecdotes, and they talk about other groups and why other groups might do this. And I think there is a way to start distinguishing between whether it's a bonding behavior or whether it's completely opportunistic or whether it's an expected part of looting. You know, I think those kind of things are pretty clear, and they do start to emerge a little bit in the research.
Okay. We have an active sixth floor overflow room. Excuse me. Hello. Excuse me. And they've sent down a few questions. I just want to ask a couple of them quickly. The first is, there's been some talk about this report you guys are working on. It's in draft form, which is why it wasn't sent out with the invitation, but it was referred to up there a couple of times. So the question is, can you tell us a little bit more about your work, both past and future, with perpetrators, and where can they find this and other related reports? And I assume it's your website, but I might be wrong about that. And then secondly, a different question, which is, what can you tell us about the UN's work on the ground, with whether it's with Ponzi or you guys or other hospitals on the ground in the DRC? And if I'm reading the question correctly, it's asking, what do you think? Are they going to take up your findings? And what's likely next steps with the UN Security Council?
Do you want to take the first one?
Is that the hard one? Which one is that?
Where can they find stuff? Your future reports.
So the actually, I don't use that word. The militia research is really preliminary. We just got back from a trip 3 weeks ago, and that's the very beginning of the pilot of the research, and we're really hoping we'll have the opportunity to continue with it. But it's less a matter of access than it is a matter of resources, to be perfectly frank. So we're analyzing preliminary results, and we're really hoping we can continue with that.
And there are other studies that we're looking at, for example, family planning issues, attitudes towards children born of rape. So we have a variety of other studies that are ongoing. All of these data are actually pretty new, so that's why they're all embargoed over that, because we've only started the analysis on them. We haven't even got many of the transcripts translated yet, so it's all in process, and that's why we haven't distributed widely the results, because we don't feel that we're probably ready for prime time yet. And that being the case, also speaking to the next topic, and that is the work of the UN and MONUC, for example. I would be somewhat horrified if the UN acted on our data alone, anyway, because it's only preliminary thus far, and I think that we have a lot to look at. However, I think that we hope it would contribute to a body of information that can actually compel the UN Security Council to look at sexual violence, as they have in 1820, as a security issue. And that being the case, MONUC to maybe retask or alter the tasking of MONUC in the field, because I think there are some significant problems with the perception of MONUC as a community presence for security. And so there's significant issues, both perceived and real, that can be addressed and improved upon. So I think that we would certainly like to engage the UN Security Council members and the NGO community at large in addressing some of these issues, but also seek to get additional information.
May I also just add, for people who are interested in research on perpetrators, that the Sexual Violence Research Initiative, based in South Africa with the Medical Research Council, but sponsored by WHO, is also right now doing a lot of work on perpetrators and even methodological and ethical guidelines for doing work with perpetrators. So on the SVRI, svri.org website, you can find more stuff.
Michal? two questions right in the row there.
Thank you. My name is Carmen Valenzuela Dal. I work for the Center for Health and Gender Equity. I come from Guatemala, where we have been for years struggling to find guilty the state of torture crimes. And since sexual violence is so linked with torture, I was wondering what are your plans in terms of sharing these findings eventually with the real government? I mean, here, the upcoming government. Are there any plans for Senate or Congress hearings? We know that until the community, the world community, not only the UN, really presses the governments, is when we really get results. So I was wondering if there are real expectations in terms of what can really be done.
And just pass the microphone down to a couple people. Let's just take a couple questions. Yeah.
I have, my name is Michal Avni with USAID. I have a comment and two questions. The comment has to do with the discussion that we just had about the spread of violence into communities and perpetrators who are not necessarily militia or connected with the military. And I think that we can't underestimate the role of ex-combatants that are being reintegrated into communities. I think that's an area that hasn't been discussed yet, and yet there are many and more of them being reintegrated. And the question is, what's their role in this violence? The two other questions that I have, I'm interested in this issue of protection and how to improve the protection of women, and the recommendations that you made based on the result that 57% of women experience sexual violence at night, and 42% were sleeping in their homes. And I'm wondering if those results came from retrospective data from hospital records that you did, or whether it was in focus group discussions, and whether you linked those women with where they lived, because my understanding is that the area is very rural, and houses are really spread out, and that's why women are so vulnerable in their homes. So if that's the case, I'm wondering how there could be a policy implication for improved protection. That's one question. And then the other question is, you talked about the fact that the study that you did also focused on protective strategies. And I'm wondering if you can share some of those results, because I don't think you mentioned that, what kind of community protection strategies you found.
Super. Well, there's a lot in there. I'll take the first one, and then maybe you can talk about the protection strategies you found. The issue of government engagement, anyway, and the degree to which we can engage, actually just add to the voice that you all have in terms of the voice to the new administration, which we all have a lot of hope that there can be some movement both with our government policies and also in the Security Council. Certainly our data is not intended for the ICC, and it's not intended for indictments. It's not because it's entirely non-linked individuals. So what we hope to establish are trends and features, but to get information out there would be part of the contribution that you all are making as well. Your questions, your question about the home issue is an excellent one, and actually we have the data. We have not. That's part of the preliminary nature of this, because we have GPS coordinates of where the attacks occurred, or the village where they happened, so we can get information in terms of the timing of the occurrence, where it happened, the relationship to militia groups. There's some actually really interesting things that are able to be abstracted from this. Now, again, with the limitation that these are women presenting to the hospital and that have access to the hospital and have suffered illnesses that have brought them to the hospital. So we have to be careful about making inferences from this and validating it by looking at North Kivu, for example, or looking at it in other settings. So while those policy implications are really placed there based on some of the preliminary findings we have, I certainly wouldn't retask Manuk based on those. I think that they need to be explored further. And there was one of the questions that Jocelyn was going to talk about.
So just, it really gets back to the very same limitation that you brought up. Protection is hard. If you're not safe sleeping in your own home with your husband and your family, you know, you really start to wonder where it is you can be safe. And two of the questions we asked in the focus groups were, is anything being done to prevent rape? And there was usually a resounding no. And then the next question is, could there be anything done to prevent rape? And usually with that question, you have to wait a really long time, and people's first reaction is, no, there's just nothing you can do. And then you wait, and people start to think, and they talk about getting rid of the combatants, you know, just reestablishing peace, which is so obvious but is so elusive. And then after that, you know, maybe community watches and certainly sensitization campaigns. So when women, and I say when because it's not even an if yet, when women are raped, they're able to stay in their communities instead of getting kicked out and becoming so vulnerable again. So certainly that is data we have, and we are analyzing it, and people did come up with ideas.
Along the side here, Kaylin, why don't you start at the end there?
Rose Schneider, Health Systems Management. I keep going back to the issue that you brought up, that the militia are well organized and have a structure and a communication system. And what has been done, I know you're in the early stages, to work at the top levels with the leadership to say it's no longer acceptable?
Yeah, so again, working with this NGO COMPS, who does phenomenal work in some of the most far-flung places in eastern DRC, I've definitely had meetings with the colonel, at the colonel level, and we do have communications with the general as well. You know, it's such a good question, and I think you certainly could, especially the Mai Mai are a very special case because they were formed from extremely patriotic men who basically took up arms to protect their own country. So that is probably different, certainly different from, you know, groups like the FDLR who are foreigners in the DRC. And there's a huge interest. When we proposed our research to the colonel of the Mai Mai, he was like, oh, it sounds amazing. Can I sit in on this sensitization workshop that you're doing and all of this? So, you know, you can argue that that's lip service, but there does seem to certainly be a genuine interest. And if that's true, certainly an entree. And there are weekly meetings and things like that that you could probably gain access to, if that answers the question.
Thank you. My name is Patrick Ipalu with American University. Actually, I'm from the Congo, and I'm really ashamed and shocked to be among you talking about this, because this is a kind of situation that didn't exist in my country 20 or 30 years ago. And today, the entire world is talking about this. And I had a comment and a very small question to ask. I think the actual problem of the DRC is a leadership problem. We don't have a central government who is responsible enough to take care of its population. And I don't know, it seems like DRC is dealing with a problem of resource chaos, if I can call it like with this. The country is so rich that everybody in the world wants to have a hand on it. And a lot of reports have been proving that the war actual in the Congo has been organized or supported somewhere in the darkness down the road by big corporations, governments in the north. And I think that as long as the world would not be stopped in the Congo, this situation cannot change. Since you are from the north and you are working the north, I don't know if you're trying to do something to influence governments and big corporations in the north to try to change the situation on the ground. And I would like to know if, after your research on the ground, are you trying to have some activities in the ground to change the situation? Thank you.
I think, you know, all of you in this room, by virtue of your interest in the topic, are probably pretty aware of the developmental activity going on in the DRC as well, including the mining industry, for example, and privatization of mines and infrastructure development. And so there's work being done, and there's a lot of work being done, and I think would be pretty progressive work being done around privatization and legitimizing the mining industry as well, which is a huge step in the right direction. When it comes to program, I would turn that question around to our colleagues from NGOs and from implementing agencies in the room, because this is, where some of the program work starts. Our role in this is really to try to, get some of the data, ask some of the questions, and bring some of the information back to the people who are going to be acting on it. But I agree, there's not only a lot to be done, I think there's a lot happening, but I think there's also a great deal to be done.
Okay, I think there's one more in that line.
Hi, thanks. Just want to add my thanks for your presentation. Elizabeth Rowley from Johns Hopkins Bloomberg School of Public Health. And talking about the services that are provided, I was, the medical services and the income generation services surfaced to the top as most important with the women that you spoke with. I was wondering about the psychosocial services and where they saw that, how they saw that, and what additional needs they felt in that area.
I think income generation is almost viewed as a psychosocial service, because without money to earn a living and be perceived as useful, women are completely ostracized from society. So it's almost a way to buy your way back into a social support network and out of this kind of rejection. And I think there's these amazing groups that women form to help each other, that are Bible studies or choir groups, and there are ways that women certainly support each other, and I think that's becoming increasingly common as people start talking about rape more, because before I think every woman maybe felt like she was keeping a secret and totally isolated, when in fact is an incredibly common problem. But groups like that I think are fantastic and important. And
there's some highly vulnerable groups, both based on physical vulnerability as well as psychosocial vulnerability as well. So, and those are many of the people that end up as patients at Heal Africa or at Ponzi, that because of profound physical disabilities, incontinence, urinary and fecal incontinence, and pelvic trauma and failed surgeries, that they undergo intensive, and there's resources there for intensive psychosocial support, but it remains very difficult without things like income generating or getting people back to their communities.
And just to say one other thing I found so interesting is a lot of women that present had a rape maybe 5 or 10 years ago, and they present with paralysis of the arm or maybe a paralysis of the leg, and Dr. Mukwege at Pansy Hospital kind of has slowly come to realize a lot of times this is simply a manifestation of a psychological problem that is not recognized or addressed. So psychological problems become so entrenched and so and remain unaddressed to the point where they have to manifest as physical symptoms in order to receive some kind of care. So there's a huge need, but it almost doesn't even have a name yet,
Yeah, go ahead.
Yeah, my name is Shali Kabanga, and I would like to acknowledge the work that you are doing in DRC, because letting the world know about the situation that is going on there, it's already a big step toward finding solution. And my question is about the protection issue, because being a woman from the DRC and having experienced the lack of protection, either from the government, either from the UN, either for anybody during the time of war. So what would you do to help those women who are not even safe in their own houses? What could you advise as a policy to address that issue?
That's a huge one. I think that Manuk needs to regain some degree of credibility in the community. It's a far bigger issue than I think that we keep saying it, and it's a party line to say that we need to increase the capacity, professionalism, and legitimacy of the police. And that's a boring recommendation, but it's a true one, and that remains that in order to see some progress for protection, you have to have civil protection, and in order to do that, the future is in civil structures like the police, and certainly educational campaigns will help. Certainly engaging men's groups will help, engaging women's support groups will help, but you have to have the rule of law, and that is, a huge hurdle. And so while almost every single recommendation that comes out talks about the need to make the police more professional and legitimate, it's the case. It seems to me that Manu can't be there forever, and to somehow find a way to establish a legitimate civilian security presence is essential.
Down here.
Hi, I'm Rina Borwanker with Africa's Health in 2010 at AED. Thanks for all of the presentations. I'm particularly interested in general in just the utilization of data, and I think all of the presentations today did a great job with discussing the complexities of doing research around violence against women, around sexual violence in general, and in conflict settings. And I think Mary, you just having bringing us all back to the ethical considerations. What I'm wondering if you could talk a little bit about is kind of the dissemination. I mean, the results of this particular study have a lot of implications for policy, for programs. But I'm curious as to if you can talk a little bit about if your experiences trying to disseminate the results of this study back to the community. I mean, when you have so many, issues with putting the women at risk. I mean, doing the research is in itself risky and puts other people at risk. But I'm just curious as to when you're working in such complex situations, how do you feed some of this stuff back to those who are involved with your research?
I think, Jocelyn, you should mention just the way women approach the prospect of giving these interviews and how, I guess, interested in coming forth they are. I certainly, one concern I have is actually that although this is all completely not linked to patients, so it's not patient-linked data at all, and there's no way to trace any of this information back to patients, and it really involves, people that have come from throughout parts of the North and throughout the South. I worry about implicating Ponzi, for example, because much of we're looking at their data, or Heal Africa. And so I worry a little bit about the prospects of implicating Ponzi as well. However, Mukwege does a fair bit of that himself because he's so outspoken and so such a campaigner for this issue that he also has brought the white-hot spotlight on the hospital as well. So, it is only through his endorsement that we would ever use these data from that hospital. Now, when it comes to the women and sharing the data, maybe you can comment on that.
Well, as far as the women go, they're so incredibly articulate and eloquent and ready to spend time speaking. And just getting back to Mary's point, of women as actors and not victims, I couldn't agree more. All we're trying to do is basically act as a bullhorn and collect all the women's voices and their narratives and their expertise, because they are the experts on this problem, and just kind of project what they have to say into an international arena. That's the goal of the research. And as far as getting the findings, we have people like Dr. Mukwege and the doctors at Panzi Hospital asking questions that would really affect their work, and we put those in the focus groups, and then turn right back around and give PowerPoints and reports in French and presentations to the doctors at Panzi, and hopefully we'll be able to expand that, and again, working very closely with grassroots NGOs, turning around the results very quickly and feeding them right back into the community. That's the goal. Yeah.
Is there a question back there? Will, back here.
Hi, my name is Madelka Macala. I'm from the Embassy of Panama. But before, I had the chance to work with Panama and represent Panama as an expert on the Great Lakes region in the Security Council. So I'm sure that some of my colleagues are very grateful back there to have some kind of data because we didn't have that at the time. So I was sitting down there negotiating some of the resolutions, 1820, the new MONUC mandate, and my question was very linked to the question of the Congolese woman sitting there in the back, and it was related to the role of the MONUC. Have you ever shared your findings with MONUC, and what do you think MONUC could do specifically in terms of protection of civilians, in particular women and children? I mean, I know that the solution that everybody is proposing is more in the long term, but right now, what is it that the MONUC can do to kind of help? Thank you.
And as much as I have, may have talked about how MONUC has a PR problem in the DRC, I also think that they're the hope right now. I mean, they're the security presence, and to increase their skill, understanding, professionalism in this, I think, is actually absolutely essential as an interim step for security. So, and I believe that their role should be bolstered as well. I believe that there's much more information. I would like the opportunity to get this kind of information, even variations of it, to the MONUC forces that are patrolling the area or in the area, because I think that there seems to be, and this is only anecdotal, a significant degree of disintegration or non-participation of MONUC with the community as well. I think there are many challenges to get MONUC to be an active, on-the-ground participant as well. So I think that there's some work to be done informationally and engaging MONUC and the leadership, particularly the patrolling forces, in understanding this. Now, that being said, the mechanism of that, or how to actually operationalize it, is as I think would be well beyond my pay grade, but something that I would like to help explore. But I think that they would have to look at. However, I think that that's the key.
Okay, and I think we have one final question. Time for one question.
Good.
I didn't want to take the final one. Last time I was in this room was, I don't know if it was October or so, when Alan Doss was presenting just recently after he began his job at the highest pay grade of MONUC. And he gave citations of the 26,000, I think, reported rapes in North and South Kivu in 2006 and things like that. And we all know it's a tip of an iceberg. But I saw an openness to being able to engage. And as I was listening to some of the other questions and thinking about, the real government, well, I'm stuck working a lot in Kinshasa with the federal government and provincial government as well. And I just kind of want to take an appreciative perspective. And when I was last there, I saw Dr. Mukwege at the Senate speaking with the Senate president. I'm more and more familiar with the role of the parliament and understanding those structures. There's a lot of opportunity, I think, to be able to play your bullhorn in different arenas. And I would hope that there's some mentoring or coaching that can perhaps happen with Dr. Mukwege so he can become more powerful with his points of entry. With his recent UN Human Rights Award, he has access to the highest pay grade in Kinshasa. And I think that there's a lot of opportunity to try to move it along a little bit, where the other efforts that are getting lots and lots of UN dollars from UNFPA around the violence against women, picking up on V-Day and things like that, if it could be substantiated with real experience that you're presenting or going to be able to put out with your data and your report, that could play really well.
And that's a great final question, I think, or final comment, because while recognizing, we always say any scientist will say the limitations of your data are as follows. So the caveat is always the limitations of the data, but the fact is that we would all hope that the information can get to places where it can make decisions. I mean, that's why we have valued our relationship, our new relationship with working with the Woodrow Wilson Center and getting information like this out to you, and to get thoughts out there. Because I absolutely agree. I mean, we are close friends with Dennis and would love to actually have him gain entree to these areas so that we could further push this issue along. We're all part of the same, thousands of hands trying to push the ball forward, and if the data piece of it can be contributory, we'd love the opportunity to do so. So those are great thoughts, actually.
Okay, well, thank you all so much, excuse me, for great presentations, for excellent questions, and really interesting discussion. I want to make a couple final notes before we close. The first is that, like I said earlier, this will be up online, archived, I think forever, within about a week or so. The PowerPoint's alongside and a summary. Also, he referred to right there, Michael referred at the last second there to a partnership with the Wilson Center and HHI. We're very much looking forward to continuing to work with the Harvard Humanitarian Initiative as we look at this and a whole bunch of other really, really important questions in terms of post-conflict, post-disaster, in this case, in conflict healthcare, and how to make sure it's best delivered. So again, thanks for great presentations and excellent questions, and thanks so much for coming.